summer of 2014 brought an Ebola epidemic that sickened at least 10,000 people and killing almost 50% of them. The Ebola virus belongs to the viral family Filaviridae. Scientists also call it filovirus. Ebola can be further divided into subtypes that are named for the location they were identified. These include Zaire, Sudan, Bangi-Bagio, Thai Forest, and Reston. The first three Ebola viruses have been associated with large outbreaks in Africa. The virus causing the 2014 outbreak belongs to the Zaire species. Ebola virus disease first appeared in 1976 in two simultaneous outbreaks, one in Sudan and the other in Congo. The latter occurred in a village near the Ebola River from which the disease takes its name. Other countries where the disease spread were Gabon, Ivory Coast, and Uganda. Since then, the Ebola virus death rate has increased up to 70%, which leaves only 30% chance of survival. The Ebola virus likely originated in African fruit bats. The virus is known as a zoonotic virus because it's transmitted to humans from animals. Other animals known to transmit the virus include chimpanzees, porcupines, gorillas and other primates, and forest antelopes. Since people may handle these infected animals, the virus can be transmitted via the animal's blood and body fluids. Once people become infected with Ebola, they can transmit it to other people if come in contact with their breast milk, feces, saliva, semen. According to the CDC, Ebola can live in the semen for as long as 3 months, sweat, urine, and vomit. People can get Ebola when they come in contact with these fluids via the eyes, nose, mouth, or broken skin. That means Ebola is not airborne, so you don't have to shut your doors and windows to be safe. According to the CDC, Center for Disease Control and Prevention, Ebola symptoms can take as long as 3 weeks to appear. Disease symptoms include diarrhea and stomach pain, vomiting, fever, headache, and unexpected bleeding or bruising. The Ebola virus does not have a cure or vaccine at this time. Instead, measures are taken to keep the person as comfortable as possible. Individuals can take several precautions to protect against Ebola. These steps include giving medications to maintain blood pressure, providing intravenous fluids to prevent dehydration, avoiding contact with blood and body fluids, and refraining from engaging in burial rituals that involve handling the body of a person who died from Ebola, educating themselves on recognizing the disease and preventing it, practicing careful hand hygiene including washing hands with soap and water or an alcohol-based hand sanitizer. However, there are a few facts you probably didn't know about the Ebola virus. For example, did you know that there is a movie that was inspired by the Ebola outbreak in 1976? It's called Outbreak and it was released in 1995. It's about a deadly airborne virus that was transmitted by a capuchin monkey. Another thing that is believed is that people in Ghana have developed immunity of the Ebola virus since it has been present there for ages. Also, you should know that the highest risk of getting infected by the Ebola virus is while handling dead bodies that were infected before.